Oh my goodness, it's the scandal inside the scandal, and Matthew Holt has the scoop. The Facebook hospital data insider story that you don't want to miss. It's the June 17th episode of Health Tech Deals.
I don't know, Mr. Massa, you may have hyped that up a little bit.
Me? A one-woman hype machine? No. Oh my God, tell us the dirt, the scandal inside the scandal.
Those stat reports that like 30 major American hospitals are sending data when you go onto their website, because presumably they're trying to figure out whether their ads from Facebook or their, however they got you there worked. They're sending data back to Facebook, including all the data you're writing down. And, their defenses were like no comment. And one of them said, well, this might have been people booking appointments with somebody else. But, things like, so that the researchers did things like wrote in, we're looking for an appointment for an induced abortion in a state like Texas. And that was being sent back to Facebook, right? That information with their IP code and an easy way to link it back to them. So, yeah, that's yet another one of Facebook and a lot of its customer hospitals who I assume are doing this to try to figure out if their people are coming to them from Facebook. I don't know why they were doing
Search engine optimization, baby.
It is. They're trying to do SEO stuff and not clearly thought through. But the scandal in the scandal, right, is this was done by a combination of Stat and a journalist outlet called The Markup. And the folks over at the Light Collective, Andrew Downing, Casey Quinlan, and others, are kind of grumpy. They think they invented this whole Facebook thing, and they were talking about it first, and they didn't get a mention in the article. So there's your scandal.
Inside the scandal.
Inside the scandal. Somebody stealing somebody else's work and activity and not rewarding for it. A bunch of bankrupt journalists taking or tag, not giving the credit due to the patient activists, blah, 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 blah. But anyway.
This is a dumb question. But as HIPAA is so old, is this considered some sort of HIPAA violation or not?
Well, I don't think Facebook can be considered to be a partner. So Facebook theoretically is not regulated by HIPAA, but theoretically, if this is HIPAA protected information given to the hospital, they are HIPAA regulated on the patient. So it probably is a HIPAA violation, in which case there should be a shitload of fines. But then they'll have to question is that, are those people, were they giving identifying data back to Facebook? Well, if it's something that Facebook can later match back to data Facebook has to do, like the IP address or whatever, then it probably is. But that's, HIPAA was done before anyone heard about, HIPAA was passed before anyone heard of an IP address. It really comes down to, this is like the other different Stat News article, which was not the same one, written by different people, which was really all about, re-identification of information, that is out there about you out in the ether, that came from your medical records, your claims history, whatever. This is going to get bigger and bigger. You were with me at a dinner last night where I started having a fight with a tool boot from UCSF about this, because they have a huge data store. In fact, all of UC, University of California Hospitals, have a huge data store which they do all this kind of stuff with. Lots of people are trying to take this data and move it around. And, I think patients are going to be getting active about it and wanting their cut if it's worth something.
Mm-hmm.
Did you talk to Casey Quinlan about it?
Oh my God, pay her for her damn data. She's been saying that for years.
All right, for the very last time, because it's the last one before next week, Pimp AHIP.
I've got my lucky dice. I've got my, walking shoes. I've got my liver in tip-top shape, and I am headed to AHIP, and you should come with me and Matthew. You can register over there on AHIP's website and get $100 off the registration fee if you enter code THCB. We are trying our luck, wooing health plan people and winning at the roulette table.
Something like that. At least we can say to our friends.
That's what you told me we were doing.
Guaranteed. I will give you. You weren't there last year where I gave Grace Finch and some other people money to go gamble at craps, and they pissed it all.
Yeah, you've never given me money to go gamble at all.
Maybe I'll give you $100 this time, and I want it better the returns than when you tell me to buy Teladoc stock or whatever happens next.
The last time I was in Vegas, I got married.
Do people know this one?
It's true.
That's how you're announcing the fact that you
Hey!
crazily got married on a whim?
Yeah, I don't know. It's relevant to the AHIP promo, is it not?
I was waiting for you to make a big deal about this, and then you never said anything in public, and now I guess the news is out. Show me around.
There you go. I got married in a helicopter flying over the Las Vegas Strip. I'm very much
show the health tech deals crowd your ring. Come on.
Oh my God, no.
Come on. All right. Okay, that's how we're going to announce it. I was going to have a big announcement way back when.
When were you going to do this? When you me like a bridal
shower? No, I would tell my parents, and then finally it's dribbled out. Jess DaMassa, no longer on the market. Sorry, boys. All right, 10 minutes.
Sana Health gets $60 million in a Series B, brings their total up to 107. You called them Oscar Light. Please explain.
Yeah, they're going for insurance for small business. They want to do it cheaper for small business. They have a medical group in Austin, so you can go to the medical group first. And kind of like Firefly and that. What's that insurer they're working with? They're wrapping around. They're basically they're kind of like they're all of that. And then if you go outside the medical group, they have a reference-based pricing. They say they won't restrict the network, but they're trying to make it cheaper and better, like a new kind of mini Kaiser. So that's why I call them Firefly. Oscar
Light. Sesame gets 27 million, brings their total up to 75. This is another B round. GV, Virgin Group, a whole bunch of new investors in it, and a bunch of old ones, including General Catalyst and Coefficient Capital and more.
This is, so the CEO, a guy called David Goldhill, wrote an article in the Atlantic back in 2009 about how US healthcare killed his father. And he said, the answer we need to have is like a proper pricing market and get rid of, big insurance companies. And now he's built this physician marketplace. It went on air for like 40 to 75 bucks, but about half that if you pay membership of like 10 bucks a month, you can get a telehealth visit. So a bit like Solve. They have 2,500 providers on the marketplace. They cover all 50 states. They said they've done 150,000 visits. It looked real to me, but like a marketplace for telehealth for cash only. I don't know how big it can get, but good luck to them.
All right, Bardavon Health Innovations buys Peerwell. Good buy, bad buy. What do you think?
So Bardavon raised about 90. Peerwell raised about 9. They're both. Bardavon is like a workers' comp, physical therapy, technology supporting system. I think it's got some clinics, I don't know. Peerwell was like a mini Hinge or mini Kaya, not as well. And all stock deal. Chrissy Farr and Omers and those guys are in Peerwell. Maybe Color also ran so far, but we'll see if they might make it. Might make it, maybe. We'll see.
All right, AIDoc gets 110 million, brings their total up to 250. Another $100+ million round. Want to point that out for all of those who are like, where's the money at?
All right, well, I thought we'd end on a big one, right? So this is the Israeli company that has like an AI diagnosis thing that overlays radiology imaging, and then they moved on to cardiology and neurology. They sound like they're not expanding that, and they're in quite a bunch of hospitals now, but it sounds like they're big round. They had a big round last July where I think they raised 75 or something, so they're going pretty fast. They sound to me like they're also kind of creep into the space that Lean TAS and Qventus is in, where they're going to do they're going to try to do AI for hospital operations. You and I were at dinner last night where there was a lot of discussion about AI and the future of it and how it's all going to work out. And then there was some discussion about whether people are ever going to go back to their offices in San Francisco or New York. An argument which I actually won, even though I was told to shut up because.
How did I know that you were going to somehow work that into this conversation? How did I know? I saw that on Twitter this morning and ignored it. Like there was a chart and an article and everything. And I was like, I'm not gonna like this because I do not want to encourage him. And then here we are now, and you've managed to work that in.
All right. But there was a lot of discussion about AI and data sets. That was the more interesting part. Yes, and how, but in the end, right, all that stuff for AI was really about how could we get really good data sets and figure out which expensive drugs work for cancer. And, I think some other use of AI, like AI doc, right, is going to be more for can we get better diagnosis more quickly for imaging and that kind of stuff, those uses. And eventually it should sort of filter through into the whole, how do we make the hospital run more effectively and how do we get more people in and out of the suites and out of beds and that kind of stuff. I don't know if we need AI for that or we just need, more sensible people running hospitals, but, we shall see. But there was certainly a fair amount of conversation about that and a bunch of other stuff last night, and I made myself very unpopular. So there we go. I'll probably never be invited back to the the UCSF Health Hub Award again, other than I happen to be one of the executive directors of it. So I guess I'm there for this year.
They're stuck with you.
Well, hang on, they're stuck with you too, because like last year when we were in the cafe room, this year it's at Health, and you and I are going to be like pimping it from the stage. So
Or maybe just me.
Or maybe you'll be pimping it from the stage, and I'll be like stuck in the basement in
the back room.
The Proud Boys don't come to get me.
Tweeting away with your little charts and your little spreadsheets of office utilization. Aren't you glad you won that fight?
having upset every major venture capitalist and UCSF employee in the place.
All right, well, let's hope that he has better luck in Las Vegas at AHIP when he's running into people and having conversations to follow along with the exploits of Matthew Holt's lust in beautiful Las Vegas, Nevada. Head on over to Twitter and follow him at BoltyBoy. I am at Jess DaMassa. I'll be there too. And to never miss an episode of Health Tech Deals or any of the other great content coming out of the blog, head on over to thehealthcareblog.com and subscribe to our email newsletter. And it gets delivered to your inbox occasionally at best these days.
No, it's back on track every week from now.
Oh yeah, back on track, sure. Remains to be seen. If you would like to sponsor our news track, did the newsletter go out on time tracker?
You just made that thing up. It doesn't exist. That's just you ranting. Plus, I will not be lost in Vegas because I will have you to direct me.
Lucky me. To see the punishment that I'll be enduring. All right, I'm done. Bye, everybody.